guys, welcome to my YouTube channel. Welcome to Zara Explores. It's been a while. I give you guys a health tips like, yo, what kind of doctor is this? Okay, but today I'm back and then I've got some super duper amazing tips for you all. Like, today is not a tip, but something special, Okay, so today we're going to talk about patients' rights. There are times that we go to the hospital, like, let's think about this. You get to the hospital and there's certain things that, there's some rights and privileges you as the patient or me as the patient, we have to enjoy. But because we don't even know our rights, we don't even get to enjoy them, then we're like, oh, okay, I'll take it like that. You know why you always say that? It's because you don't know your rights. You don't know them. So today, Dr. Dava is here to give you all your rights as a patient. So from today, I'm not just going to go and be like, that is it, I'm okay, I'll just manage it like that. Here lies the case, you have your rights and you have to fight for your rights. You get it? Okay. So when we're talking about patients' rights, what are patients' rights? Patients' rights are a list of guarantees that's accessible to those who are receiving medical care. For instance, being accessibility of care, dignity, confidentiality, and all those things. Your right to information, fair treatment, and all that. So, our first one on the list is we have patients have the right to effective communication based on individual needs. So, special services will be given to address your needs. You get it? So, this is a situation where I have come to the facility and then I'm supposed to go for, should I say, a surgery or a CS. You shouldn't see me because I sell fish or I'm not in a Range Rover. So you're not going to give me that effective communication. You're not going to attend to me or make things clear to me for equally understand what you're trying to say. But just tell me, yeah, I'm just going to do surgery. So your appointment, this is the kind of facial expression they even give you. It puts you off. At the end of the day, you're going to tell other people that, oh, these people, their facility is bad, they don't talk well, and we don't want that. So the patients have the right to effective communication. Communicate to your patients in a right way, in a respectful way. They are humans like you. You chose your career to be a health worker. So if she is your patient, don't forget she's even bringing you the money. I mean, he or she is even bringing you money because when they come and work, when they come in for, medical treatment, when they pay, see, it's your salary. Don't forget that. Okay. So our next point, patients have the right to be involved in decisions about their care. So before and then during the treatment, they have the right to certain decisions. For instance, there's a medication that you can give it in IV and you can give it as in oral form. So if the patient has made the decision not to take the IV or the, let's say, injection, for instance, just give the patient the oral medication. That is what he or she wants. Allow the patient. After all, the patient has the right to make decisions. For instance, let's say you be like, oh, for your breast, you can either take a mammogram or an ultrasound. Don't just tell the patient you have to take mammogram when you know the person is going to be exposed to radiations and they all know what radiations are, and you just limit the person to just one thing. There are choices. Allow them to make the decisions for themselves. Ultrasound is also good. So if the patient feels ultrasound will be okay, allow the patient to go. Okay, so our next point we have. So patients have the right to agree to care. So before agreeing to care, what is the treatment suggested? Do you understand? What is the possible benefits? What are the risks of that treatment? What are the side effects? What could happen if they refuse the treatment? Let them understand certain things. It's not everybody who knows why you're going to give me. For instance, I have malaria. She doesn't know why I'm going to give her injection. Because she's like, oh, there's this yellow medicine I've been taking when I have malaria, so I feel it's effective. Let her know maybe that one is not effective. Maybe this branch is maybe if she's buying Lonat, it's not. Let's maybe if Lonat is not effective, let her know Lonat is not effective, but it's better if she gets Malatu or something. Let them know this is the reason why. And then what other treatments could be used? For instance, taking the ultrasound in the mammogram. Allow her, let her know, oh, maybe although ultrasound doesn't have side effects, it wouldn't really view everything you want, or it won't give us a full picture of what we want, or make her know that radiation has side effects, but it will be better for in order to help us in our diagnosis. In the sense that one is better. And also, what are the outcomes, including those that are unexpected? Let them know everything. And then what limitations on protecting your confidential information, if any. So if the patient agrees that I should use his or her information for something, allow it. If they don't want it, don't. Just keep it confidential for them, and then you are good to go. And if they don't want the treatment at the facility, don't get angry. It's their right to say I don't want the treatment here. So if that's the case, can you refer me somewhere? Don't get angry and sack them away. Kindly refer them. Like, it's so polite of you, and you don't even know that referring them, they might have their personal reasons why they want to be referred. Refer them, please. Allow them to go. That's where they'll find easy treatment. Just allow them to go. If they feel, oh, when they went there it wasn't okay, they want to come back, please, they will come back for it. And it's so nice to let your patients feel free, feel at home, etc., etc. Our next point: patients have the right to have pain treated effectively and to be given information about pain and also pain relief measures. You see, so you have to do all this for the patient. And then patients also, seriously, this is very important, patients have the right to know about the staff who treats them. Now, what do you guys think about this? They have the right, they have it. You can't be keeping yourself because I am Mrs. Whatever, so I don't want them to know I'm the one. Please see, this is a serious business. This is someone's health. She can be in a critical situation and has to, for instance, you come in the morning and be like, oh, Madam Miriam, please, I'll be giving medication at 2 p.m. You don't tell her your name. Maybe she was even feeling it at that time, and you don't tell her your name. She can't remember your face. At least telling her your name or telling him your name will even help her. So if the next 2 hours time or the next time at that 2 p.m. it's not Madam Miriam that comes, sorry, it's not maybe Doctor whoever comes there, and is Doctor maybe with a different name comes, because you've mentioned your name, she'll be like, oh, this doctor came earlier, so I don't know why you are here to give me the medication. Or maybe she or he has sent you to come and administer the medication. Then there's a small, or there's a simple understanding there. But here lies the case: you've not given the person the name, nothing. What do you want the person to do? And that's when you see the misunderstanding coming up. They're like, oh, this doctor, I didn't like her, or I didn't like the way, let's avoid these things. We health workers, and with the upcoming ones, we are learning. So let's try and avoid things like this, okay? Okay, so my last point, this point is very, very crucial to me. Like, that's how I can say it. It's very, very, very important to me. The patients have the right to privacy, confidentiality, and security. Let me take security first because it's very important. The patient comes to your facility and tells you, I want only my wife to visit me. The patient is telling you that because who knows, his wife is the one going to bring the food. She is the one going to pay for everything. She is the one he trusts. And he has given you the reasons why he wants just his wife to come there. Kindly respect that for the patient. Don't be like, oh, what's the meaning of just your wife? What if your mother comes? If his mother comes, ask him, oh, your mother is here. I know you told me this, but I want to ask you again. Maybe you have a change of mind or something. It helps. If he doesn't have a change of mind, just agree to whatever he has told you and respect that for him. And also, talking about security, you have to make sure their properties are safe and secure. For instance, they have some things they brought there. Maybe there are certain things required of them to bring to the facility whilst they were admitted. You should be able to take care of them. You should be able to keep eye on those things for them. A patient shouldn't leave a facility saying, I lost my money when I came here. I lost this when I came here. I lost that. No, it's not a good thing to say about a facility. And also, if let's say there's a surgery going on and then you want to do a little filming, you should inform them, because at least in that sense you're not even going to show the person's face. The person will feel, oh, it's my abdomen you're showing, I don't feel comfortable with it, why don't we stop the recording, or why don't we avoid this, or I don't want it, then just take it off. But if the patient says, oh, okay, that's so nice, you've asked and they've approved it, it's very good, it wouldn't disrupt your surgery process, it wouldn't proceed. This is to my upcoming health worker. See, let's all take notes. Patients love security, privacy, and confidentiality. No one doesn't want this. Everybody wants this. Even me as a person, I want it. You are in school and you're like, my host, I want to in a room. Why do you want to in a room? Or even you alone in a room? It's strictly because you want your privacy and you want to keep things to yourself. You don't want anyone hearing your conversations or anything. The same way your patient also needs that. So please, let's help our patients, okay? And also, their privacy should be respected. Seriously, should respect it. He doesn't want that, don't do it. He doesn't want this, don't do it. Seriously, let's all make sure we treat our patients with care. And please, as a patient too, please, we know you have your rights, but please try to comply with the hospital rules and regulations. I'm going to give that one to very soon, but that'll be my next episode. So guys, I'm happy for doing this. Like, it's my favorite thing to do. I'm so happy. Don't forget to subscribe, don't forget to share, and don't forget to like. Please, if you have any questions, if there was something you didn't understand, please kindly leave your questions, your suggestions, and all your comments in the comment section. Dava will be here to reply all. And also, if there's any other thing you want me to talk about in my next videos, kindly comment that in the comment section. I will take note of it and then I'll get back to you on that. Please don't forget to share the video. See, you can't be enjoying this alone. Nah, it's not right. You can't be enjoying this alone. You as a patient, only you want to know that you have rights. See, share with your sister, share with a friend, share with a colleague, share with a family. Let's all know our rights as patients. Thank you all. Bye.